Natalie, are you preparing for your glamour shots?
How did you know?
Ah, beautiful.
No, I'm just showing off my recent Kybella treatment.
I love it. Are you so happy to have that little under neck bulge?
I'm so happy. I had just a little bulge here, and I think probably from having back-to-back babies, but it was something that just kind of bothered me in pictures and kind of made me feel a little bit insecure about my face.
Your face looks amazing, and look at how svelte and toned her neck is. How many treatments of Kybella did you have, Natalie?
1 vial.
1 vial just once, and look at what it did. So I think it's really important to know that when you go to a dermatologist who knows how to inject Kybella, you're not getting like 6 treatments. I've seen it at some spas where they're like, oh, you need 3, you need 6 treatments. You did not need that. It is important that as the doctor, you know the right approach, you inject it the correct depth, and so you get that tightening too. Do you see how your skin is tighter too?
Yeah, and I feel like this was a great treatment for my age. You know, I'm 38 years old. I'm happy to share that, but it was something that felt like it was the right treatment for me. But there are other treatments that may be good for people who are older than me or younger. Can we talk about that?
There are so many ways to treat that little under neck bulge. There's Kybella, like Natalie did. That's an injectable that helps dissolve the fat. I like Kybella for your age because it helps tighten the skin too. CoolSculpting is another modality that I love that uses cold to suck away the fat, and then the skin tightens on top of that. That sometimes we do in people who have a little larger neck or, more bulk to reduce. Another thing that's great for this area are threads. Threading helps restructure the skin. So if you've just got lots of laxity, we can put some threads. I've done some threads in my face, and in the future, I'll do some in my neck. There's also Botox. People forget about Botox, Dysport, Daxify for the little creepies. So we get these platysmal bands, and so you can inject a little bit if you've just got a crepey neck. So there's multiple modalities. I don't ever expect the patient to choose it. That is my responsibility as their doctor, is to assess their skin, assess their fat, see their laxity, and see what combination of modalities can be done. We have done some Dysport for Natalie's neck in the past too. So you can see that help tighten, help with her masseters. So there's a multifactorial approach that your doctor needs to know.
And also, one thing that made me feel safer as a patient is you knowing where to inject, how to inject, the depth, that is so important. I think a lot of places don't have that level of educational expertise. So for me, that made me feel really safe.
Thank you. All we do all day long are inject and do surgery, so we know exactly where to put it. Unfortunately, I have seen where people have had Kybella too superficially and it causes little dimples in the skin. Or conversely, if it's too deep, then you won't get that tissue tightening. And that's so important to get the skin to be tighter on top.
And I loved the combination between Dysport for me and Kybella because it sort of gave me more of that overarching tightening and lifting and eye brightening as well. So.
Yes. Yeah, you can see how heart-shaped and svelte Natalie looks. So
thank you.
That's a really
Thanks
nice combination modality.